Hi, guys, and welcome back to part 2 of our case study 35. Just a slight reminder of our scenario. SP is admitted to orthopedic ward. She has fallen at home and has sustained an intracapsular fracture of the hip at the femoral neck. The following history is obtained from her. She is a 75-year-old widow with 3 children living nearby. Her father died of cancer at age 62. Mother died of heart failure at age 79. Her height is 5 feet 3 inches. Weight is 118 pounds. She has a 50-pack year smoking history and denies alcohol use. She has severe rheumatoid arthritis, had an upper gastrointestinal bleed in 1993, and a coronary artery disease with a coronary artery bypass graft 9 months ago. Since that time, she has engaged in very mild exercises at home. Her vital signs are 128/60, blood pressure, pulse 98, respiration 14, temperature 99.0 degrees Fahrenheit or 37.2 degrees Celsius. Her oxygen saturation is 94% and is on 2 liters of oxygen by nasal cannula. Her oral medications are rapidosol 20 milligrams per day, prednisone 5 milligrams per day, and methotrexate 2.5 milligrams per week. So sit back, enjoy, and learn all you can as we continue part 2 of our case study. When monitoring Mrs. SP for wound infection, we need to monitor her vital signs for fever, tachycardia, increased respiratory rate, which may indicate infection, oxygen saturation for hypoxemia, low blood, lack of blood supply can impair healing and lead to complications, including bacterial infection. Examine incision for redness, edge approximation to see if it increases in size, increased temperature, swelling, and indurations. Indurations are abnormal hardening of tissue caused by consolidation of edema, and then document our findings in case there are any changes. Note and document characteristics of drainage, like the odor, the fluid exudate, accommodation, and the type of exudate, to note changes like in the color. Evaluate complaints of recurring or increasing discomfort, like pain, color change in the pH. Administer antibiotic therapy as prescribed by the physician. Maintain aseptic technique for dressing and changes of wound care. For example, the 1 inch margin. And remember, sterile touches sterile.
Interventions that should be implemented to prevent complications secondary to immobility. Mrs. Aspie should be up and out of bed post-op day 1. The nurse, along with the physiotherapist, monitors the client's ambulatory status. If client is confined to a bed, Mrs. Aspie should alternate the extension and flexion of her legs. While sitting in a chair or lying in bed, there should be no pressure to hinder venous flow. No pillows behind the knees or high elevation or crossing of legs should take place for at least 6 to 8 weeks. Another nursing responsibility is to identify that the client is at risk for the development of pressure ulcers. Clients should be turned frequently. This will reduce the pressure on Mrs. Aspie's skin. Devices such as heel boots and special transfer equipment, such as a mechanical lift, are useful in reducing pressure and sharing force. Deep breathing techniques and coughing techniques are also useful. This helps to move around respiratory secretions to larger airway passages for expulsion. The nurse should assist Mrs. Aspie to breathe deeply 10 times every hour while she is awake. An incentive spirometer can also be used to provide feedback of respiratory effort. This should be used every 2 to 3 hours while a client is awake. Elastic stockings or mechanical aids, like a compressive device, can be used to enhance and stimulate the milking and massaging of veins when the leg muscles contract. However, if these devices are not applied or sized properly, this can impair circulation in the legs, and the devices are now inactive. If elastic stockings are being used, they must be removed and applied twice daily, and the nurse is responsible for the inspection and care of the client's skin. Lastly, we have constipation. This is one of the most common problems that can result from decreased physical activity. Another factor that can lead to constipation includes the loss of privacy and embarrassment if Mrs. SP needs assistance. Uncomfortable positioning on a commode and the unavailability of a caregiver's assistance if help is needed can also lead to constipation. This would then lead to bowel irregulations in Mrs. SP's day-to-day living and can result in abdominal discomfort and loss of appetite.
Some predisposing factors that can be identified in Mrs. SP's medical history, which places her at risk for infection, bleeding, and anemia, would include firstly, the administration of the certain medications robendazole, deltazone, and methotrexate. Certain medications, such as steroids, can make your immune system weaker and increase your risk of infection, and some might cause unusual bleeding. Mrs. SP's 50-year smoking history also increases her liability to respiratory tract infections such as tuberculosis and pneumonia. Another predisposing factor would include the fact that Ms. SB already has a history of GI bleeding in the year 1993, and that she also has a coronary artery disease with a coronary artery bypass 9 months ago.
For a patient with rheumatoid arthritis with hip arthroplasty, SP nutritional needs is as follows: calcium and vitamin D, vitamin B12, fiber, and potassium. Older adults need more calcium and vitamin D to help maintain bone health. Eating more fiber-rich foods to stay regular. Fiber also can help lower the risk for heart disease, control weight, and prevent type 2 diabetes. Foods such as cereals, fruit juices, green leafy vegetables, foods that increase potassium and reduces sodium. So therefore, when considering SP's rheumatoid arthritis with hip arthroplasty, mainly consider vitamin D to help maintain defortified low fat or fat-free milk or yogurt each day.
Explain 4 techniques you can teach Miss SB to help her to protect herself from infection related to medication-induced immunosuppression. First and foremost, what exactly is medication-induced immunosuppression? This is when the immune system becomes impaired as a result of medications that are used in treatment of systemic diseases. These examples of these medications would be chemotherapy that is used in patients who would have cancer or lupus. Another example of this would be steroids that can be found in patients who have thyroid disease or patients who are plagued with asthma. And with all of that being said, one of the first techniques that we can teach Miss SP is hand hygiene. We as healthcare personnel know that this would be the most effective way to prevent infections. Secondly, we would teach Miss SP if she has any drains or any type of dressings, it would be best to leave it to the medical staff to come and deal with it. It wouldn't be in her best interest at heart to bother with it. It can cause contamination and could cause and make an easy getaway for infection. Thirdly, we would advise Ms. SP to stay in a more secluded area. It would be in her best interest that she would not be exposed to anything that could cause any type of infection towards her. And last but not least, we would advise her that if she is experiencing any inflammation around her body that she cannot deal with or explain, it would be at her best interest to seek help from any healthcare facility so that early signs can be detected of infection.
Factors to be taken into consideration when selecting a rehabilitation facility for Mrs. SP. Firstly, her age. We would want a facility that is competent in geriatric rehabilitation. We would want a facility that would provide a multidisciplinary team that would be specific to her needs. Does the physician at the facility prescribe therapy for orthopedic surgery? Can they handle the fact that she has rheumatoid arthritis? A dietitian for her nutritional needs, a psychologist for mental support, especially at the fact that she has a 50-pack a year smoking history, social workers for personal and at-home issues. Is the facility accessible for her? The location, is it near home? Do they offer pickup and drop-off services in the event that she cannot be transported there or her family is unable to accompany her because of their busy daily lives? Do they offer boarding services in case the facility is at a distance so she don't have to subject herself to sitting on such a long drive, which may in turn be painful for her? Family participation, is it encouraged? Flexible visiting hours for the family. Children being involved in the therapy. What supplemental services is offered? For example, music or relaxation therapy. Last but not least, outpatient physician therapy and home care. In the event that the patient is unable to come to the facility, would they be able to do it at home for her?